Okay, so let me ask you a couple questions. So we did your first case about a year ago, right? And I think it was about 3,500 grafts.
Yes.
And how you were pretty bald before. I'll put pictures up. Showing it. How did adding that hair change your life?
I think it just gave me more self-confidence. I don't think I had bad self-confidence to begin with, but this was it was just nice to have hair back on top of my head.
And how much downtime did you have when we did your case the first time?
I didn't have much downtime at all. The first few days I wasn't quite myself, but then probably by the third day I felt pretty much back to normal. I could tell that I'd had something done, but as far as activity level, I was back to normal, except I wasn't working out yet.
And I remember you saying you had just retired from the military, and so as you grew, switched to a civilian job and could grow your hair out, did a lot of people know you had this done, or not really?
No, matter of fact, the day before I had my procedure done, I had retired from the Air Force, and so for the past 10 plus years I kept my hair really short, and I started growing it out before my procedure. So during my transition, no one really noticed that I had had anything done. They just thought I was growing my hair out. The only person that actually asked me if I'd had something done was my father. He lives about 5 hours away, so I see him every month to 2 months, and he's the only person that actually flat out asked me if I'd had something done.
Okay, and your limitation that I told you was that you have just really fine hairs, but you've got pretty good density. So we did the front third of your head last year from essentially this Q-tip to the front. And as I've posted many times on these videos, no matter how tight you try to pack these skinny hairs with dense packing, this is never enough. And so when we do a second case last week, the strip we got, I can't remember how many grafts we got, but we got a lot of singles. And rather than put 2 or 3 of them in a single hole back here in the back, where you've got things growing a couple different directions, we almost always take at least some of the singles that we get and augment the frontal hairline, which is why you look a little thinner here, because I trimmed that down and then you put some hair in. So I think that a year from now, that your frontal hairline is going to be just fantastic, even with that thin hair you have. And you did a perfect job cleaning. I'll bring the camera over to you. For guys that are doing a hair trim, this is what it's supposed to look like. How much pain did you have this time?
Not much at all. Matter of fact, it was probably better this time because I knew what to expect. And matter of fact, I was out at a hockey game 2 days after the procedure.
Great. So here's the recipient area at day 7, and that is fantastic. There's always a happy medium between doing too much cleaning and pulling out my hair, or pulling out your hair, and not doing enough and having crusts build up that get stronger than the attachment of your hair into your scalp and then pulls out your scalp. That is perfect. And then your donor scar, you had a really good donor scar before, and although your head's probably a little tighter this time. How much more tight? You were just telling me it doesn't feel that tight this time either?
No, the first few days I felt like I had a little more tightness than my first procedure, but now I feel like I'm probably at the same stage of that I was last year after my first procedure.
Okay, well thank you. We'll get this to